Today, the Foster Hospital for Small Animals has one of the highest small animal teaching caseloads in the entire country. Our clients seek us out because our hospital offers comprehensive care. So just like a human referral hospital, we offer all of the specialties: cardiology, neurology, oncology, and in particular our emergency and critical care unit is a go-to for the entire region.
We look at our hospital as a way to combine all of the resources that we have in veterinary medicine in one place, focused for the service that takes best care of the pet and best care of the family.
We were able to aggressively resuscitate her and work together with the surgeons in order to address her underlying problem. Honey had a lot of obstacles that she needed to face. She was malnourished, she had been down and hadn't been walking for a very long time, and so as a team we were able to combine nutrition with physical therapy as well as supporting her with love, because we are her surrogate family while her owners are gone.
I have a very unique relationship with Tufts. I'm both a graduate of the veterinary school and now chair of the school's board of advisors. I run several veterinary practices around Massachusetts. I hire veterinary graduates from the school, and I refer cases to the Foster Hospital. On a personal level, my own dog Sarah has been a patient here at the Foster Hospital. Sarah had several complex orthopedic problems, and even with my practices and my board-certified surgeons, I felt that Tufts was still the best place to have her procedures done.
Molly's now over a year out from her treatment and doing great. She's running around and walking without a problem, enjoying life with her family with no evidence of tumor recurrence.
She's had 2 mast cell tumors, and not long after the second one was removed, she was diagnosed with lymphoma. We brought her up here, and they confirmed the diagnosis and started her on chemo. And with treatment, 9 months was the average, and it's now been almost a year and a half. I think that team approach made a huge difference, and she loves it up here. She thinks it's playtime. She comes up to be with all her friends.
In the mid-'80s, my dad had a vision of wanting to create the finest small animal hospital of its kind, both in the state-of-the-art facilities as well as the quality of patient care. He recognized that having a fine teaching hospital would help develop top-notch veterinarians who have a strong impact on both animal and human life.
There is a distinctive trifecta at work at the Cummings School. That includes all 3 components of what we do: the innovative research, the high-level specialty care, and the training of the next generation of veterinarians. It all has to work together. What distinguishes an academic veterinary medical teaching hospital from others is the fact that we do innovative, cutting-edge research, and that research is what advances the profession, as well as on a daily basis the care of each and every one of the patients that we see.
Just as Mass General Hospital provides innovative clinical care for humans, the Tufts Foster Hospital for Small Animals provides similar care for animals. The 3rd and 4th year students play an integral part in our care team. They offer compassionate care to our pet owners and their pets during their time of need.
The bottom line is that there's really no substitute for hands-on experience, and this clinical year is not just this enriching experience, it is crucial experience. We have such a large caseload here. We see such volume that I feel very fortunate that I've seen cases that some clinicians who've been here for 20 years have said, I've only seen one of these. And to have that privilege to be able to work up this difficult case with such seasoned faculty is really incredible. And to have that direction that this is how you need to think about the case and this is how you need to progress as you address this patient's needs, it's really been an honor. And it is so exciting to see the progress I've made and to know that when I graduate in a month, if I was given an animal to spay or neuter, I know what I need to do and I know the background to problem solve through the situation.
The foster hospital renovation is about much more than bricks and mortar. It's about what happens inside the walls. And this is particularly true in terms of how we can deliver the very best care for the animals that come to us and the clients that bring them to us. It creates an environment for our students as well to learn in an optimal way with cases that challenge them and that also they have the tools to do the very best with.
This renovation will enhance a patient-centered experience for both the patient and the client from their entry to the hospital until their discharge.
The fact that Tufts was an option and they were ready for us and it was only 35 minutes away, it was meant to be. I will always be grateful for the staff at Tufts giving Honey back to us, allowing her to get well and come home, and she's Honey again.
Simply put, this renovation adds space to our hospital, which currently serves twice the caseload for which it was intended. It will include a larger, welcoming reception area, larger exam rooms, which will enhance the learning experience for both our students and clients, an expanded diagnostic imaging service, including new ultrasound equipment. Ultrasound is an important tool in establishing many diagnoses. Finally, we're adding a reflection room with access to an outside garden so that when clients need to make important decisions, they will have a peaceful, comforting, quiet space. Since 1985, our hospital has been dependent on the generosity of our friends. Improvements are periodically necessary to keep the quality of our clinical service high. We know our community values these services that we provide and has successfully helped us renovate in the past.
I was asked why Sally and I donating early to the fund for the renovation of the hospital. I've thought about it, and I've thought about it a lot, and I think it really comes down to the people. This is an institution with wonderful people from the top to the bottom. We want to just support them, and that's why we did it.
This support gives us great confidence that we can make this vision a reality. Together, we can.
Together we can.
Together we can.
Together we can. Together we can.
Together we can.
Together we can.
Together we can.